Hello, welcome everyone. Today we're going to be talking about suicide in Broward County and some ways that we can stay mentally well during the COVID-19 outbreak. My name is Lois Simpson. I am the Director of Suicide Prevention and Wellness Initiatives at United Way of Broward County. So I want to preface this conversation just by offering the National Suicide Prevention Lifeline, crisis text line, and some information about 211 Broward. It can be difficult to talk about suicide, especially if you do have some personal experience. So if you do feel like you need someone to speak to during or after this conversation, you can reach out to the Lifeline through their 1-800 number. You can also just dial 211 from any phone and that will connect you to your local lifeline. You can do an online chat at suicidepreventionlifeline.org/chat. And there also is a text line, and you do have to start it by texting home to 741-741. Of course, if you're worried about your immediate safety or feel that someone that you care about is in danger, please dial 911 to have help immediately. So what I'd like to cover today is some national and state level data. Then we'll talk about some current trends. Then locally, what we're seeing here in Broward County, some suicide warning signs and additional risk factors during the pandemic, some tips for staying well during the pandemic, some places you can find help, and then what United Way of Broward County is doing about suicide in our county. So first, some national data. Many of you may be aware that suicide is one of the leading causes of death in the United States. It is currently the 10th leading cause of death, but it's the second leading cause of death for the 15 to 34-year-old age group. Someone in the United States dies by suicide every 10.9 minutes, but somebody attempts suicide every 26 seconds. Men are much more likely to die by suicide than women, 3 times more likely, but women attempt suicide 3 times more than men. So what that means is men are completing suicide more frequently, and generally the reason for that is that they do choose more lethal methods in which to complete their suicide. And then suicide is a very expensive cost to our country. It costs us about $69 billion annually. Now, state data, and we are talking about Florida here. Suicide is the 8th leading cause of death in Florida, and people die by suicide every 3 hours in our state. We are slightly below the national average. The national average is 14 deaths per 100,000 people, and we are at 13.95 deaths. And we're ranked 37th in suicide rates among the 50 states. There's also a huge cost to Florida, and we're looking at almost $3 billion annually for costs related to suicide. So now just some relevant trends and research that I wanted to cover. So suicides have a greater impact than we additionally thought, and they are being considered more and more as a community trauma. So each suicide death is said to affect up to 135 people. So when one person dies by suicide, everybody that person is related to, works with, interacts with on a regular basis is affected by their suicide, which would mean that almost half of the people in our country have been affected by suicide. We know that language can change the way that we think about something. So changing our language can reduce stigma around suicide. So generally we want to try to stay away from the term committed suicide. That word committed is often reminiscent of, doing something wrong or having committed a crime. So we are trying to replace that with words like died by suicide or completed suicide. And you can kind of think about that like, you wouldn't say somebody committed cancer if they passed away from cancer. So we want to treat suicide just like the brain disease that it is. And we can do that by eliminating that word committed. Person first language is also important when we are talking about any mental health issue, but especially suicide. And what that does is it helps to define a person as a person instead of by their mental health issue. So when you're referring to somebody who is dealing with suicide, you can say a person experiencing suicidal thoughts, or a person who has experienced a suicide attempt, as opposed to a suicidal person. Also, suicide is a short-lived phenomenon, and it does actually have high recovery rates. So many people believe that somebody who is suicidal will be suicidal for their whole life. And while many people who have been suicidal do have significant mental health issues that they have to work through, 90% of people who survive a suicide attempt do not go on to die by suicide at a later date. 70% of people who survive an attempt will never attempt again. So what that tells us is that suicide is really almost like a crisis that is very short-lived generally, and if we can pull somebody out of that very short period of their break from their reality, then we can most likely save their life and have them complete their life throughout the full term. So now I'd like to cover some suicide trends here in Broward County, Florida. And all of this data comes from our medical examiners' suicide death reports. And we're going to be covering the last 6 years. We do not have numbers for 2020 as of yet, but we will look at 2019 through 2014. So these are the completed deaths. You can see we had a pretty significant spike in 2018. So part of the work that United Way, excuse me, is doing is to kind of try to understand better why that may have happened. Although it is great that we saw a decrease in 2019, we still have 235 people here in our county who died by suicide last year, which is terrible, and we hope to get that down to 0. When you look at adjusting for population change, the same patterns hold true. This is the breakdown by gender. So it's pretty obvious that men are completing suicide about 2 to 4 times more often than women in Broward County. And again, that is on par with the national trends. Here we have the breakdown of deaths by age range. So this one kind of stood out to me and the other people working on this project. A lot of times when we talk about suicide, we immediately think of teenagers and young people. And while young people are dying by suicide at higher rates every year, we can see in Broward County that it is quite obvious our highest age range, highest at-risk age range is 40 to 64, followed by 65 plus, and then 25 to 39-year-olds. So it's actually our older adults who are at a higher risk. So this could mean a couple of things. We do a lot of suicide prevention for youth, so this could mean that those efforts are being effective and that what we're doing is working. But it could also mean that we're really missing an opportunity to work with our older folks here in Broward County, and that maybe we could shift our focus a little bit to include them in our prevention efforts. This next slide is the breakdown of completed suicides by race. This is also on par with our national trends, whereas we're seeing white, Caucasian people completing suicide much more frequently than Blacks, Hispanics, Asians, or other races. Our 2 highest minority groups in Broward County for suicide deaths are Black and Hispanic. Since Broward County is a minority-majority county, meaning that most people in Broward County do identify as a minority race, this data is actually especially surprising because we would expect to see higher rates of minority suicide deaths than we do just based on our population breakdown. So this does really indicate that there is a higher risk factor for white people in Broward County when it comes to suicide. This chart here is a breakdown of deaths by month. I know it's a little overwhelming to look at, but there is a misconception that suicide follows a seasonal trend and that most people who die by suicide are dying around the holiday season. So we can see from this information that in Broward County, at least, that is definitely not the case. There is not really a clear pattern that can be identified, but what we can take away from this graphic is that there are certain months where we see a significant spike, such as November in 2018 and June in 2016. So through our research, which I'm going to talk about a little bit towards the end of this presentation, we are going to be trying to understand what may have happened that month or in the months prior to result in this spike. This slide demonstrates the method of death, or how the person chose to end their life. So the most common method of death in Broward County is gunshot wound, followed by asphyxia, which would include hanging, poisoning, which would include drug overdose, and then blunt force injury, which would include a fatality from the railway or from a fall or jump from a building or a higher platform. This is on par with national trends. Gunshots are the most common way to die by suicide, and the most common and most gunshot deaths are suicides as well. So there is a pretty big connection between firearms and suicide. So since the level of gunshot wound deaths was so significant, we wanted to take a closer look at the breakdown to see who is dying of a suicide gunshot wound in Broward County. And it was pretty clear that it is our older white males here in Broward County who are dying by gunshot wound suicide. So that will help us to focus our prevention efforts when we do look at targeting our older population here in Broward County, that our white males who own firearms may be at significantly higher risk. Here we see a breakdown by geographical area. I do want to preface this by saying this is the location that is taken from the death report, which is the location of death, not necessarily where the person resided. So we may see higher rates in our cities that have our hospitals. So Fort Lauderdale, Hollywood, and Pompano Beach are the three geographical areas that we are seeing the most deaths. Here we have the rates adjusted for population. Although Hollywood, Fort Lauderdale, Pompano Beach are still high up there, they are overtaken by Lauderdale by the Sea. Just a little disclaimer, Lauderdale by the Sea has a very, very small population, so even one or two deaths would put them up there in the higher ranking cities. So we can assume that Fort Lauderdale, Pompano, and Hollywood Beach really are our hotspots for completed suicide deaths. And this is a look at rates between 2018 and 19. And the purpose of this information would be to identify any significant spikes so that we could take a closer look at what structures or what's occurring in that city that may be attracting people to that location to end their lives. Something else that we are going to be looking at is the pattern of people traveling from their homes to a certain location to complete their suicide. So are people from the west side of the county traveling to a certain location on the east side to end their lives? And if so, how can we stop that migration, and how can we discourage people from going to that location? So some suicide warning signs, and if you have ever researched suicide, you may be familiar with a lot of these warning signs. But talking about wanting to die or kill yourself, looking for a way to kill yourself, or gathering the materials such as buying ammunition or hoarding some pills, purchasing ropes or things of that nature. Talking about feeling hopeless or having no purpose. This one is starred as well as two others because it is one of the major predictors of suicide. So if somebody is expressing to you that they feel hopeless, they feel their life has no purpose, that would be a point of concern. Talking about feeling trapped or being in unbearable pain. Another important one is burdensomeness. So when people feel like they are a burden to the people that they love and that they care about, that is a big warning sign. I have heard, and I'm sure you have too, people say that folks who end their lives by suicide are being selfish, but the opposite really is the case. People who end their lives by suicide do so because they just feel so bad for inflicting the pain that they're feeling onto the ones that they love. So that feeling of being a burden is really a big predictor and a big warning sign. If you see increased use of alcohol or drugs, someone acting especially anxious, agitated, or reckless, and then expressing a lack of belongingness or connectedness. And this could be to others, to their family, to their workplace, to their community, to their religion. A sense of thwarted belongingness is one of the other big predictors of suicide. If somebody is sleeping too little or too much, withdrawing from the things that they normally engage in, showing rage, talking about revenge, or displaying extreme mood swings, you should be concerned. I want to make a point about the mood swings. This does not just mean if somebody is extremely irritable or depressed. This could refer to somebody becoming all of a sudden, happy and more upbeat and seeming more content. If somebody that you know to be, a generally depressed person who you have been concerned about all of a sudden seems to be better and okay and happy, it may be that they are, and that would be fantastic, but it may be that they have found a solution to their pain, and that solution may be suicide. So it would be prudent to ask those questions and to probe further and keep an extra eye on your loved one if you do notice that. Some extra risk factors are at play during the COVID-19 pandemic. We are quarantined in our homes. We are not engaging in our usual activities that help us feel well. Many of us are experiencing financial burdens or financial insecurity, or unsure about the future in general. So it can be an especially stressful time, especially for those who are at risk for suicide. So financial instability is very stressful, and this can include uncertainty for future financial stability. So even if somebody is still employed and still, they still have their income, that uncertainty of what is going to happen, how long is this going to last, can be a stressor. We talked about age being a risk factor. So in Broward County, older adults are the highest risk. And now during the COVID-19 pandemic, older adults are also at a higher risk for contracting the the coronavirus. So they are staying home more often. They're not able to engage with their family. They're not as well versed sometimes in the technology that can help us to stay engaged with each other. So they can become even more hopeless while they're being isolated. A pre-existing mental health condition is also an additional risk factor. Some folks are unable to maintain their appointments with their mental health providers, or they just don't feel as connected doing telehealth as they did visiting their groups or their therapist in person. It can be more difficult for people to stay on their medication if they're missing appointments, or if medications are being prescribed virtually. That can be a difficult thing to navigate for some folks. So people with a mental health condition are at a higher risk during the pandemic. And then substance use disorders. So, people are staying home, there's not that much to do sometimes, and there are increased rates of drug and alcohol use during the quarantine. So people who, for example, are in recovery may find it more difficult to cope when they're not able to do those things every day that helped to keep them well and keep them in their recovery. So those big three that we talked about on the last slide were hopelessness, thwarted belongingness, and burdensomeness. So those are also exacerbated during COVID-19. Hopelessness because, we don't know what's going to happen. It can be hard to picture your future and picture, the next couple months. Can you plan that celebration? Can you plan that wedding? Can you plan that vacation? What are we expecting here in the future? And not knowing can increase levels of hopelessness. Thwarted belongingness, because it is obviously more difficult to stay connected to all those things that we mentioned, to your loved ones, to your community, to your workplace, your school, your place of worship, because we are all isolated. So it may cause some folks to feel more alone and like they belong less. Burdensomeness, we all have to rely on each other now, especially the elderly. They have to have everything done for them, their groceries delivered, their medications delivered, so people are having to rely on others more than ever before, especially those who are medically vulnerable. So a level of burdensomeness and can increase, and that feeling of independence is decreasing for some. So there are really some real risk factors during this pandemic. But I want to talk about some ways that we can stay well and some ways that we can encourage our loved ones to stay well while we are socially isolating. So first, take a break. Even if you need to schedule the time when you are going to stop watching the news, including your social media. Even just hearing about the pandemic repeatedly can be really triggering and upsetting, and increases that feeling of hopelessness and, doom. Something that I have done to help myself remember to do this is you can set timers in your phone, or you can even ask Alexa to remind you to take a break from the news and take a break from your social media. So just encourage you to be intentional about setting that time in your day. The second tip is to keep moving. We are stuck inside, but that doesn't mean that we have to be couch potatoes. So try to take walks if you can, even just taking a break and doing some deep breathing exercises or stretching, dancing around to a song, even getting some sunlight or fresh air if you have a patio or an outside space can be helpful. There are tons of free workout videos on YouTube and all over the internet. So even just doing a 15-20 minute, little workout video in your home can get that blood flowing back to your brain and help you to feel better. The third tip is to nourish yourself. So it is very easy to, order food all day long and snack on potato chips when you're staying home and you don't have anywhere to go and look good for, but trying to eat a healthy, well-balanced diet is going to help you to feel better overall, and that impacts your mental health. Also, getting plenty of sleep and trying to keep drug and alcohol use to a minimum or avoid it completely. The fourth tip is to relax. So many of us are working from home. We may be full-time parents, or we may be homeschooling our kids right now. So it can be kind of difficult to differentiate that home relaxing time from your work and productivity time. And your work and leisure is becoming blurred a little bit, especially for those folks who are working or learning from home. So making sure that you plan some activities such as, writing, watching movies, engaging in the arts, listening to music, or playing a game, something that is relaxing to you and engaging. Reading a book would be a great option, but make sure that you do take that time to intentionally unwind and disconnect yourself from the work or learning or productivity that you have been doing all day. The fifth tip is to stay in touch. So use your phone, use your video chats, and talk with people who you trust within your circle about your concerns. I encourage you to be open about, how difficult this is. This is a strange situation that most of us have not and will never experience again. So sharing those concerns with someone that you trust in your life, and you may be surprised that they have similar concerns, and having them as a support system is going to be crucial to wellness. And then the last thing is ask for help. If you are just feeling down and stress is getting in the way of you, completing your work or your school or just your daily activities for several days in a row, I really encourage you to reach out to your health care provider. Most health insurance agencies and providers are offering virtual visits and telehealth now. They are usually the same or even lower cost than a traditional visit. So, you're not going to have to leave your home and expose yourself to the virus in order to connect with your healthcare or mental health provider. So I definitely encourage you to ask for help if you need it. Some other tips for wellness during COVID-19 can be found on the CDC website, the World Health Organization website, SAMHSA, or the Substance Abuse and Mental Health Services Administration, and the National Domestic Violence Hotline. The reason that last one is included is because people who experience domestic violence may now be quarantined with their abuser, and there are increased risks of domestic violence. So there are tips on this website for staying safe during the pandemic, and also a hotline in which you can seek help. You can also join some virtual groups. These are all free and open to the community. They welcome everybody, so you don't need to feel, awkward about logging on. South Florida Wellness Network is an amazing organization. They have such diverse groups that they're offering now virtually, including emotional support, wellness, creative arts, meditation, and journaling. And their website and phone number is provided. And then we have the Florida Initiative for Suicide Prevention, or FISP, and they offer more support groups for suicide providers and then people who are impacted by suicide through a friend or family member. And again, their phone number and email address is provided. Here are some hotlines to keep in your back pocket. We did already review the National Suicide Prevention Lifeline and the Crisis Text Line and 211, but I also wanted to mention the Trevor Project, which is a hotline for LGBTQ specific issues and LGBTQ folks who are experiencing suicide crises. There is the Spanish National Lifeline, so that is services provided in Spanish. There's a hotline and text line for veterans. And there is options for deaf and hard of hearing. the National Domestic Violence Hotline, which we just mentioned, and also useful is the Women in Distress Hotline. This is local to Broward. It is a 24-hour crisis hotline, and they do also have an emergency shelter. So briefly, I wanted to touch on the work that United Way of Broward County is doing to address suicide in Broward County. They have formed a group called the Broward Suicide Prevention Coalition, and I wanted to highlight a couple of their projects. This is the structure of the coalition, and there are several groups focused on different issues related to suicide. So one that I wanted to highlight is a project called the Suicide Deep Dive, which is a combination of a psychological autopsy and a root cause analysis. So what that means is that we, in partnership with the American Association of Suicidology, we have trained 20 folks here in Broward County who have clinical experience to conduct something called a psychological autopsy, which is, it consists of going out into the community and interviewing loved ones and family members, colleagues, classmates of people who have died by suicide. And we are going to be doing this for every person that has died within a 6-month period. So the purpose of this project is to try to answer that why question. So, I reviewed the data and was able to tell you what, how old the people were, how they died, where they died, what race and age they were, but none of that tells us what happened to this person, what happened in their lives, what trauma did they experience that led them to believe that ending their life was the best option. So we are hoping that this project will help us to analyze why people are dying here in Broward County of suicide. And if we're able to identify some trends, we can perhaps look at some gaps within our system and close those gaps right away so that we can ensure that other folks don't experience the same trauma and the same experience. Another group is the Lethal Means Work Group. So we are going to be working on something called the Gun Shop Project, which is a national best practice for partnering with local gun shop owners, gun distributors, gun range owners in order to provide primary prevention within the gun community. So it involves bringing the firearm community into the discussion and partnering with them on how we can keep your customers safe, how we can make sure that people who do purchase firearms are not at risk for suicide. Another important project is taking place through the Suicide Response Work Group, and it is called Zero Suicide Broward. Zero Suicide is a national evidence-based framework which offers guidelines for providers on how to make sure that they are offering the highest level of suicide crisis care. So generally this is adopted by, one hospital or one agency. So we are going to attempt to have every provider in Broward County get on board with this so that we can all become zero suicide competent, zero suicide certified across Broward County. So no matter where you go for care, everyone in that agency is aware of how to give you the best level of service, from the receptionist to the, facilities maintenance people, obviously to the providers and the clinicians, but making sure that we're all on board on how we can stop people from dying by suicide. If you're interested in getting involved in any of those groups, I would love for you to reach out to me. All of the groups are open to community volunteers, and we love to have people's input. All of the meetings are currently being held virtually. So please send me an email if you would like to get involved or if you'd like some more information. Thank you so much for joining me, and wishing you all the best and stay well during the pandemic.